It is almost the end of January, and many of you may be coming to the end of Dry January. It's a social movement encouraging abstaining from alcohol for the month. And it's one example of a trend towards sobriety as more people, especially younger generations, are not drinking like years past. 13 on Your Side health reporter Elena Holland spoke to addiction experts about the Sober Curious movement and why you may consider expanding Dry January all year.
After a whirlwind of holidays and toasting a new year, often January comes with health goals.
We're looking at making changes and resetting for the year.
Dry January, a movement of sobriety for a month, has grown in popularity across the country. Dr. Colleen Lane is the medical director of addiction medicine for Corewell Health. She says they're seeing fewer young people seeking help with alcohol addiction.
One of the major things we see are people who are looking to change their relationship with alcohol.
But changing that relationship is easier said than done, especially in Beer City, USA.
That cultural aspect, we celebrate it. We just got through the holidays. It has been very normalized. Alcohol is sold in grocery stores, gas stations, corner stores.
Daniel Wickland is a nurse practitioner with addiction medicine. He says alcohol has been normalized in our culture, so they often work with the individual to find out what is their ideal relationship with alcohol. And it doesn't have to be all or nothing.
One of the examples I like to use is the LGBTQ+ community. But it's very normalized in that cultural setting. Really working with them to identify that they have a safe space to enter care. They have the safe space and people who are willing to recognize their unique characteristics while they're entering care.
But why stop or lessen alcohol consumption? Wickland says most people say it's because people notice they generally feel better when they stop drinking.
We also see improvement in sleep and cognition.
While others point to known medical health detriments of drinking, like leading to liver disease or cancer.
You might not think about in your 20s or 30s the fact that drinking 2 or 3 drinks a night might put me at higher risk for breast cancer.
We have come from a long history of you have to stop alcohol, it is bad for you, instead of really focusing on that relationship piece, understanding that alcohol has a social cultural place in society, in our relationships, in our celebrations, that sometimes exploring reduced use is a reasonable outcome versus no use.
So Elena, how can someone begin to stop or limit drinking?
Yeah, you can try slowly cutting back, maybe setting a challenge for yourself to have only 1 drink on a night out or at dinner. Find things you enjoy doing that have nothing to do with alcohol. Also, there are so many drink alternatives or even mocktails on the market today. Try one of those if you're just looking for a little something special to be drinking, but you don't want the effects of alcohol. And if you're worried you may have a problem with your drinking, talk to your primary care doctor. Corewell Health's addiction medicine program also makes it easy to visit with quick appointment timing and even walk-in options.
Thank you, Elena.